Casey Cullen, and my presentation is on heart disease. What is heart disease? Heart disease is the #1 killer in the United States. Heart disease is a broad term that can be used to describe a range of diseases affecting the heart. Some diseases of the heart are coronary artery disease, heart arrhythmias, heart infections, and heart defects. Coronary artery disease is the most common disease of the heart. Atherosclerosis is the buildup of fatty plaques in the arteries that can lead to heart attacks or strokes. It can also lead to cardiovascular disease. Other types of heart disease are cardiomyopathy, which is the thickening or enlarging of the heart muscle. There is no known cause for this disease. Heart infections can be caused by bacteria, viruses, parasites, and medications. Heart defects are another disease of the heart, and defects can often develop while a baby is still in the womb, but can also occur later in life. Who is at risk for heart disease? Well, the answer is quite simple. Males and females both are at risk for heart disease. There are some risk factors that can contribute to who is at higher risk for heart disease. You can develop a heart disease later in life or from birth. Risk factors can both be controllable and uncontrollable. Some of these risk factors include genetics, birth defects, and menopause. All three of those are uncontrollable risk factors, whereas smoking, diet, exercise, obesity, and age are all controllable risk factors. All different types of heart disease have different symptoms. Some of the symptoms for atherosclerosis is angina, which is chest pain, shortness of breath, numbness in lower and upper extremities, and atherosclerosis is the #1 cause for heart attacks, and the most common symptoms for a heart attack are chest pain or pain in the left arm. Other heart diseases have quite different symptoms. Heart arrhythmias are fluttering in the chest, racing heart rate, slowed heart rate, dizziness, or chest pain. Heart defects have symptoms of cyanosis, swelling in the legs, abdomen, or around the eyes, and shortness of breath. Cardiomyopathy, which is the thickening of the heart muscle, has symptoms of breathlessness, swelling of the legs and ankles, bloating, fatigue, or rapid bounding heartbeats. Heart infections have symptoms of fever, shortness of breath, weakness or fatigue, swelling in the legs or abdomen, changes in heart rhythm, or unusual skin rashes. There are many different treatments for heart disease. The most recommended treatment is lifestyle changes. If lifestyle changes are not enough, there are medications that can be prescribed by your doctor. If lifestyle changes and medications are still not enough, surgical procedures can also be performed. Lifestyle changes that are very important include smoking cessation, diet, which includes low calories, and a diet that is low in sodium and low in fat. Also, it is recommended that people who are at risk for heart disease get at least 30 minutes of exercise per day. If lifestyle changes are not enough, medications can also be prescribed. Some medications that are prescribed are diuretics to lower blood pressure, ACE inhibitors or beta blockers, blood thinning medications such as a daily aspirin therapy, which is recommended for older adults, and cholesterol lowering medications such as statins or fibrates. Sometimes lifestyle changes and medications are not enough, so surgical procedures can be done. The most common surgical procedure is an angioplasty. During this procedure, a small catheter is placed into an artery in the arm or groin, and a small balloon is threaded through the blocked artery and inflated to reopen the artery that is currently blocked. An angioplasty can be performed numerous times to clear numerous blocks. A more invasive surgery that can be done is a coronary artery bypass surgery. This is when a vein from another part of the body is used to bypass the blocked section of the artery. This vein is usually taken from one of the legs. Each year in the United States, 600,000 people will die from heart disease. That comes out to about 1 in every 4 deaths. By the year 2020, heart disease will be the #1 killer worldwide. Heart disease is the leading cause of death for both men and women. Every year, about 715,000 Americans have a heart attack. Of these heart attacks, 525,000 are first heart attacks, and 190,000 people have a heart attack who have already had one previously. Coronary heart disease alone costs the United States $108.9 billion each year. Each year, more women than men are killed by heart disease. It is the #1 killer in women and more deadly than all forms of cancer combined. It kills approximately 1 woman every minute. The American Heart Association has created a movement called Go Red for Women. This movement advocates for swifter action and more research for women's heart health. Go Red for Women is helping educate women on heart disease so women can start to make healthier life choices before it is too late. Go Red for Women is also a nonprofit organization committed to bettering the lives of American women. They are committed to education and prevention of heart disease. Heart disease is not preventable and there is no cure, but there's a lot that can be done to decrease the severity of the disease and its effects. Americans must take responsibility for their own health. They need to recognize symptoms and signs for heart disease and heart attacks. It is important to make annual doctor's appointments to have their health status evaluated. Men and women both are at risk for heart disease, and there are both similar parts of heart disease as well as differences. Women are more likely to be diagnosed after menopause and more likely to be killed by heart disease. Men are less likely to make lifestyle changes and more likely to undergo surgical procedures related to their disease. The best thing Americans can do is educate themselves about heart disease so they can take the necessary steps to reduce their risk factors and lead to healthier lives. Education on healthy lifestyle can help save lives. Thank you for listening to my presentation about heart disease.